Hi, everyone. Welcome to another episode of Wellness Day, a podcast coming to every Wednesday here from the Jehangir Wellness Center. My name is Kavas Jehangir, and I'm your host again here from the JWC studio. Now, today I've got a very special guest. I've got Dr. Vaman Khadilkar, who is a endocrinologist. No, wait, it's a pediatric endocrinologist, right? That's a mouthful. So why don't we start? Thank you so much for being here, Doc, first of
My
all.
pleasure.
But why don't we start by first telling us what that big mouthful means?
Right. So, good. Thanks you asked that because pediatric endocrinology was a very new branch actually when I came from England in 1997.
Okay.
So, a lot of people actually used to ask me, what do I do?
Yeah.
Even some of the pediatricians.
Right.
So, primarily, it's a branch that deals with hormonal disorders in children
Okay.
and adolescents. So, now it is extended to 19 years.
Okay.
And as you know, as patients develop confidence in you,
Right.
they keep coming to you. So sometimes I do end up seeing patients who are beyond 20, but I don't like that.
Okay.
So we look after children's growth disorders and hormonal disorders, right from birth until their adolescence.
Okay. For some reason, I always thought it was focused on diabetes.
Yes, true.
Or only diabetes. for that
Pediatric
matter.
endocrinology's major chunk now is
Right.
diabetes.
Okay.
Say about 25, 30 years ago, it used to be short stature, obesity,
Okay.
thyroid, and last in the list used to be diabetes.
Okay.
Now it is short stature, obesity, diabetes,
This has become the big challenge.
thyroid. Yes.
Why is that? Is it lifestyle? Is it, well, first of all, actually, let me take we can take a step back. When we're talking about diabetes. My, I always get confused between type 1 and type 2. So if you can just quickly tell us what the difference is, then we can
Yes.
get into exactly what you were talking about, why diabetes has become such a large portion of your work now.
I mean, diabetes, as the word says, it's just high sugars.
Yeah.
There are about 20 causes of diabetes in children. But the common ones that we get in children now is type 1
Yeah.
or the insulin dependent diabetes.
Okay.
But strictly, if you stick to the pathology of type 1,
Right.
it's an autoimmune disorder.
And that's the one that people are born with or sort of.
No, they're not born with it.
Okay.
But within few years since their birth, their pancreas gets damaged.
Okay.
And they're just like thyroid. It's an autoimmune process. They develop antibodies and it just kills off the islet cells of pancreas.
I see.
And then for all your life, you're insulin dependent.
Okay.
That's type
That's right. So that's the type 1, is the lifelong one. Okay.
lifelong one. But in adolescent nowadays with obesity
Yeah.
and poor lifestyle, we are getting type 2 as well.
Okay.
So,
young,
adult,
huh?
so young. In fact, our youngest patient with type 2 is 8-year-old.
Oh, wow.
Yeah. So
Which
you-
earlier used to be what? Like in 20,
way
30
beyond
years ago,
adolescence, yes, 20s. But now, it's coming earlier and earlier because of obesity, strong families.
Right, right, right.
And that leads to type 2.
Wow.
But that often is not insulin dependent all life.
Okay.
It's only a few, perhaps months. And then, most of them would get onto oral medications.
Okay.
Type 1 is the most difficult one.
And then why has this become such a big thing now?
Well, actually, nobody knows.
Really?
Yes. In the sense, I remember when I was getting trained as a pediatrician
Yeah.
in middle 80s.
In the UK, you were saying.
No, that is in India.
First in India. Okay.
That time, we had never seen a kid with type 1. Either we missed it altogether,
Right.
which is possible,
Okay.
or it was just not there. And in around year 1995, WHO in a bulletin had said that in the new millennium, there would be as many diabetic children as there are epileptics today.
Oh, wow.
And I didn't believe it. But here we are, 2025.
Yeah.
We have as many, if not more, diabetics than epileptics today.
Yeah. Absolutely.
So we don't know what is the exact second trigger. You're born with a tendency to form antibodies, and then something else happens. That could be anything from viral infections to some food item
Yeah.
that leads to the second hit, causing autoimmune damage and type 1.
So the second point that you mentioned, the food aspect, that seems to be what a lot of people seem to be talking about. Nutrition, that seems to be affecting children, especially to create this kind of scenario today.
Yeah.
You know, with ultra processed food and
Yes.
the accessibility to it now also, which perhaps wasn't the case earlier.
Yeah, and I think it's also related to all these additives and preservatives
Absolutely, yeah.
and so many things that get added to the food. Taste enhancers,
Right.
they all have a role to play.
All these emulsifiers
Yeah.
and all these
But
things.
nothing actually has been proven,
Yeah. Okay.
proven to be absolutely sure about it.
Okay. But coming back to the healthy aspect of what you look at, what are the things that you look for to see that a child is growing normally?
Right. Now, yeah, I think
And how do we ensure that?
you have touched upon an area where I would probably never stop talking.
Okay, well, that's
Because,
we can
yes,
keep
I mean,
going
yeah,
until
growth
they
is,
until they tell us to stop or they run out of video.
yeah, I think growth is something which has been my and Dr. Anuradha's passion.
Yep.
And Jehangir Research Center goes the wings
Yeah, yeah.
to really produce norms for Indian children. So, coming back to the question, how do we know that children grow normally? Typically, when I see a parent, they say that compared to other children in the class,
Yeah.
my child is short.
Short. Yeah. Okay.
But that's not the ideal way. The ideal way actually is to plot them on something called growth chart.
Okay.
So, growth charts are norms for that particular community from 0 to 18 years.
To 18. Okay. Goes all the way to 18.
Yeah, and they are for height, they are for weight, they are for body mass index.
Okay.
And at Jehangir's Research Center, we have now established 21
Parameters.
different parameters
wow.
and their national norms.
Okay.
Many of these have now been endorsed by the Indian Academy of Pediatrics.
Oh wow. Something that we started that.
Yes, so they are now nationally recognized.
Wow.
Only last year, for the obesity guideline, our waist circumference charts were endorsed as national charts.
Wow.
Yeah.
Okay.
So I think that's a very major thing that we have been able to achieve.
So that's a holistic way of looking at it.
And in this day and age,
Yeah, absolutely. No, no, that's but it's fascinating to know that there's so many factors that one needs to look at
yeah,
versus just some, as you said, just simply someone who just looks at someone's height.
and in this day and age, what we have done is we have tried to make it digital.
Right.
So we have apps. So there is an Indian Academy of Pediatrics growth monitoring application. So you can put just your child's date of birth, gender, parent's height, child's height, weight, and it will draw the chart for you. It will tell you whether he's growing normally or not, where is the deficit. So growth chart is the best way to know.
Okay.
But any kid, just for general public, I think I would say,
Yeah.
any child between the age of 3 years to say 10 years for girls and up to 13 years in boys
Okay.
is not growing even 5 centimeters a year requires help.
I see. So that actually comes to my next question. How do we ensure that our children are growing well?
Right. I think the basic thing is nutrition,
Yeah. Always.
prevention of disease. So that's where, this preventive pediatrics comes into play. That's where it starts right from before the baby is born.
When you mean preventive, you mean things like vaccines?
Yes.
Okay.
Vaccinating children, then proper nutrition,
Yeah.
breastfeeding in first 6 months,
Yeah.
then weaning foods, then proper nutrition. Indian food is very high carb, high
Right.
fat. So, educating parents in what is the right proportion of protein, calorie, fat, and other minerals, vitamins, educating them.
Yeah.
And for today's generation of children with such fierce competition, getting 9 hours of sleep has become impossible.
Absolutely.
But that sleep hygiene is as important as exercise.
Right. And I'm so glad that people are starting to realize it now.
Yes.
And I'm seeing that more and more. And it really, really needs to be pushed.
So I think 4 simple components for good growth in children would be number 1, good antenatal care to the mom and good nutrition to a girl child.
Yeah.
Not only when she gets pregnant, but to a girl child. So the baby's birth weight is good.
Yeah.
Then it is nutrition, some exercise every day,
Right.
and good amount of sleep. 9 hours for younger children and 7 to 8 later on.
So you're prescribing 7 to 8 hours sleep for me every day.
At least 8, I would say.
I'm happy with that. But how do you manage that for yourself? Just a little off topic.
Well, I think I managed to get about 7 hours of sleep. Not
Okay.
bad. Yeah, not bad.
Right. So yeah, that's what we said. The prevention part is so important for children's growth. Now you said 0 to 18. Now, does that mean that people stop growing at 18, or
Right.
that's also kind of like a gray area?
I
Or,
think that's a very good question you asked because, see, gone are the days when girls grew until they were almost 17, 18, and boys grew until they were 21.
right.
But today, most girls are not growing beyond 15.
Oh, really?
They're maturing earlier and earlier and earlier.
So you're saying there's actually a change in
Yes.
biology at a
This is a change
population level.
in the demographics, really.
Yeah.
Complete change in the demographics. So girls are stopping their growth by 15 and boys by about 17, 18.
Wow.
See, if you go to school and look at children in 10th standard today, they look as if they are in college.
Yeah, yeah. I've always noticed this. I mean, I'm now also starting to reveal that I'm becoming slightly older. But like, I was thinking about this exact same thing. I went back to my school recently for a reunion, and obviously the school, kids and all were there.
Yeah.
And I was just thinking, when I was this age, these people look way, way older.
Much older, yes. So they stop growing early. So parents must come to us at a much younger age. So for girls, I would say they should really come to us at 6, 7, and 8 years.
Okay.
And for boys, around 10 to 12.
Okay.
That would be the right age to consult somebody for a growth problem.
Right. Right.
Many a time they come very late after they have reached maturity, and
Okay.
nothing much can be done about it.
And for girls particularly, this might be a taboo topic, but it's something that we should be talking about. We should be talking about openly. Is the girl's first period? How does that affect a girl's growth?
Most girls only grow for about a year and a half to 3 years maximum after menarche, after
Okay.
the first period. But
Oh, that's called menarche. Is it?
menarche, the first period is called menarche.
Okay.
But the thing is, by the time they have menarche, 97% of growth is done with.
Because people are, you're saying, becoming more mature
Much
earlier.
more mature.
So why is that happening actually? Any sense
Again,
on that?
coming back to the same food thing,
Really?
additive, there's something called endocrine disrupting chemicals.
Okay.
They're everywhere in our environment, right? From polyvinyl chloride, BHC, DDT, all food, preservatives, additives, everything.
All sounds very complicated.
It is very scary, actually.
Yeah.
It is scary. But it's everywhere, so we can't escape it anymore.
Yeah, yeah.
That's one of the factors, major factor I would say, that is bringing everything early. Besides, of course, nutrition.
Yeah.
Whenever a kid feeds well, and if too well, then maturity comes early.
Okay. But talking about exercise is one of the aspects. Maybe this is a myth or not a myth. People say that the kids shouldn't be weightlifting or doing anything in terms of resistance training as until their bones have been
Yes.
no,
No, I think that's more of a myth.
Right.
Unless you are doing some very heavy weightlifting.
Of course. Yeah.
Otherwise, all exercises will have the same effect.
Right.
It's beneficial.
It's hugely beneficial.
Beneficial in terms of building very healthy bones, good muscle mass, preventing obesity,
Yeah.
reducing fat mass. So I think it should be promoted.
Yeah, so exactly. So people or parents should not be afraid of sending their kids to the gym if it's done right. As you
If it
say.
is done properly. Yeah.
Yeah, yeah. So that's a myth that we need
It's
to.
a complete myth. And another myth is exercise actually improves your height.
Right. Yeah.
It doesn't. It doesn't. It allows you to express your best,
Yeah.
but nothing beyond that.
Okay. Like how carrots make you smarter. Well, what are the actually? We're talking about these myths now since we're on the topic. What are these kind of common myths that come to you that you need to debunk?
Number one is most people still believe that when a girl hits puberty, in the sense when she starts her periods, she actually grows faster
After.
afterwards.
I see.
Which is very
But you
wrong.
just
She's
changed.
already done it. That's first myth. Second thing is this. What is the exercise that will make my child taller?
All right.
All have the same effect.
Okay.
Then there are these strange things, like some almonds will make your child smarter
Smarter.
or more intelligent. Similarly, they feel some food items will make the child taller. That's not the case.
Right.
And another common thing is, but one thing people are realizing now, especially those who are, say, in the sports as a career or those who are in the showbiz.
Yeah. Yeah.
Many of them now want to know how tall my child would be. And that's something I do want people to know and understand. That we have developed this model called the growth prediction model.
Okay.
So if we do a hand X-ray on a child beyond 5 years of age,
Okay.
and we know the child's height, we can actually predict how tall the child would be.
Oh wow.
This is immensely useful when it comes to choosing a career or a therapeutic option.
In the sense, well, what do you mean by therapeutic option?
For example, if say there is somebody who comes to me at the age of 5 with height X and the parents are pretty tall
Yeah.
and they believe that my child is going to be very tall.
Yeah.
I can tell from the bone age whether it's going to be true or not. Sometimes tall parents' children do end up being very short, but that we can predict from a bone age.
Wow, this is fun. I never knew this. So it's like a
Yes.
simple X-ray of the hands
Just an X-ray and the kid's height. That's all we need.
after the age of 5 will
Yes.
tell you how.
And it really works very well. We do it all the time.
Okay. If I do it now, will it tell me whether I'm able to be taller or not?
And now it will be all
Too late. Too late for me. Okay. Well, coming back to myths and popular fads, or whether you want to call it fads or not, the very popular thing right now seems to be this discussion around the drug Ozempic.
Yes.
I just thought I'd pick your brain on where we stand, not we stand, but what your opinion on it is. Because it seems to be fairly popular and to be, I mean, I'm not a scientist in any, or a doctor in any form, but there does seem to be some merit in its usages from everything that I've read.
Yeah.
So I just thought I'd get what you're thinking or what your
It
views
actually
as an
started
expert.
as an anti-diabetic medicine.
Exactly.
So it's a GLP-1 analog.
What does that mean in a nutshell?
That actually means there is hormone which is secreted by our gut,
Okay.
which essentially lowers the sugar. But it also controls the appetite. So when people used it in diabetic patients, they suddenly realized that the diabetes is improving.
Yeah.
This is type 2 diabetes.
Yeah.
But also the weight loss is significant. And with significant weight loss, it's easier to control diabetes.
Exactly.
That's how this semaglutide, the Ozempic.
Okay. So it's like a happy byproduct.
Yes. So then people started using it only for obesity. In
So healthy people, you're saying. Or not to say that diabetics are unhealthy, but people who don't have diabetes.
but
use
they're
it.
just obese without diabetes.
Right.
And there are many trials now done in the world which
Yeah.
have shown that yes, it would cause a significant weight loss, sometimes as much as 20%, which is huge.
Yeah.
Some people may lose 20, 30 kilos in a year.
Right.
But the downside of this medicine is that the minute you stop it, the rebound is much quicker and sometimes worse.
Okay.
So American Academy now says that if you start it once, you keep taking it.
I was going to say there needs to be sustainable, or
Which
you
is-
need to do this
which is-
lifelong. Then
Which is wrong because it does.
we don't know the long-term
And
effects.
in pediatric practice, it's certainly a no.
Oh, absolutely. Can you imagine if someone has to be on something for the rest
Having
of their life?
said that, the last guidelines that we wrote for Indian Academy of Pediatrics, we have now said that in children older than 12 years
Okay.
who have failure of medical therapy, failure of diet and exercise, lifestyle change,
Okay.
and if there are more than 2 or 3 complications, such as high blood pressure, dyslipidemia, that is high cholesterol, etc.,
right.
hypertension, then you may use this medicine.
Okay.
Even
there
in
is-
adolescents.
so there is some, merits in openness. It's not all bad at the same
No, it's not.
time. Okay. That's what I just wanted, because it's the buzzword right now. And a lot of people have been asking me to ask experts like you about it. So I thought we'd get fairly
I think the real downside is the rebound weight gain.
Yeah, which is something one has to be mindful of. Well, Doc, it's been fascinating talking to you about all these aspects from children to Ozempic for adults and things like that. Any last words that you'd like to leave us with?
Well, I think I would like to definitely say that all parents who have children
Yeah.
should actually start plotting their growth right from birth. Jehangir Hospital in every child's record, birth record, puts the growth chart until 18 years of age.
Yeah.
So
With all these parameters,
Yes.
21 parameters.
Every birthday, they should just measure height and weight and put a pencil dot. Keep
along with a
plotting.
little piece of cake for them.
Yes, and
Small piece, since we're
please.
being healthy.
As long as the line is following a particular tram line,
Yep.
they're okay.
Okay.
Else, they should consult a pediatrician or somebody who knows growth in children.
Okay. Exactly. That comes back to preventive.
Because most disorders actually come up with growth failure first and then symptoms of disease later.
Okay. So we can address that early.
Yes.
That is the main
So, in fact, growth monitoring alone in the world has been shown to be the most effective strategy when it comes to prevention and treatment of childhood disease.
Okay. Don't just get well, stay well.
It's something, I mean, if the pediatrician is not doing it, then the parents should do it themselves.
Okay, lovely. Everyone together needs to be vigilant about that. Thank you so much again for your time again.
Thanks
Doc.
for having me, and it is wonderful talking to you.
Absolutely.
Thanks a lot.
Thank you all, and look forward to joining us next week. Thank you.